Hello, everybody. This is Dr. Bill Curry at UAB. I'm a general internist here, and I'm the current governor for the Alabama chapter of the American College of Physicians and past president of the Medical Association. We appreciate those organizations helping us get these videos out about COVID-related topics. Today, we're delighted to have Dr. Craig Hoesley, who is professor of medicine and infectious disease here at UAB and is the senior associate dean for medical education, which includes both medical school and residency programs. Today, we want to talk about medical students. Craig, what's happened to all our medical students? They suddenly vanished a few weeks ago.
Yeah, so right in the middle of March, we received some guidance from the American Association of Medical Colleges that asked us to take a look at our current situation and encourage us to consider pulling students from the clinical environment, the hospital and the clinics. And I think the rationale for that was really twofold. One was the safety of the students, and two was PPE preservation in the hospital as well. So in the teaching environment, we're going to use more PPE than what we would outside of the teaching environment. And at that point, early in the process, at least in Alabama, we certainly had concerns in those areas. And of course, we didn't want to put our students at risk. So we pulled everyone out middle of March. And since then, our first year students are still in their organ-based module curriculum. And we converted quickly with the help from many of our medical educators on campus to move to a fully online curriculum, including small group sessions, team-based learning, laboratory sessions. Everything went online, as well as our testing and our assessments have gone online, and that's gone smoothly for the first year class, and they will continue in this mode until they complete the MS1 curriculum early in June. Our second year students had already completed the second year curriculum and were in the independent preparation phase for the USMLE Step 1 exam. As you probably know, that all the testing centers, which for the USMLE exams in Alabama is the Prometric testing centers, are all closed. So that's been a bit of a challenge to figure out when our students can take their first licensing exam. Also recognizing when they open, there's going to be a real backload of students trying to get tested. So we've extended out the testing time frame for the second year students and for Step 1 to the end of June, when we believe that some of the sites will start to open up. If they open up ahead of that, we'll start testing the students. We've also waived the requirement that students cannot take coursework or have opportunities in the third or fourth year curriculum prior to taking Step 1, just so that we can take advantage of this time period to get them some academic credit and keep them on pace to graduate on time. In terms of and just a comment about that is that, one of the areas that we wanted to leverage during this time frame was kind of a disaster medicine course, or a course around, preparation for pandemics. So we're partnering with Fort McClellan in the group there, which nationally does a lot of this work. And during the month of May, our students will be enrolled in a course, a fully online course around disaster medicine preparedness for situations like this. So we want to take advantage of this situation to really hone in on and reinforce principles in infectious diseases, epidemiology, but extend that even further around the impact on the community and the role that physicians play in preparing for this situation, not just the direct patient care. So, we're trying to take advantage of this situation and extend our educational objectives so they can learn from this.
Sure. If I just mention, in case people don't know what Fort McClellan is, that's near us around Anniston, and it's where the Army's anti-chemical warfare potential or programs that have been headquartered for many years.
And they have tremendous resources around preparedness for not only in kind of an infectious disease related pandemic, but other things too, like biowarfare, et cetera. So we're gonna leverage this opportunity to kind of teach the students about these scenarios and reinforce some of the principles that they have learned around virology and infectious diseases and epidemics. So
yeah, that sounds great in a bad situation. You're trying to make lemonade here.
Right. And I've had some calls with some of the other UAB health professional schools, and it would be fantastic if we kind of all do this as a group as well. Mm-hmm. For public health, nursing, optometry, dentistry,
Sure.
Others as well. So I think that's a great opportunity. But in terms of when the students can come back, the upcoming third-year clerkship students and then the upcoming fourth-year students that are finishing clerkships is we're really relying on the national models. Right now, the one that we're looking at is the one from Seattle that you're seeing in the media quite a bit on where the curve is going to land. And right now, based on that data, which is subject to change, these models are only good as the assumptions that are put into them.
Yeah,
but
there's been a good bit of controversy about that particular.
There has, but I think that in all of the models, at least for Alabama, it looks as if we're certainly going to be coming down that curve middle of June, and again, subject to change. Lots, what our state is planning to do relative to social distancing, what our city is planning to do relative to shelter at home, all could be impactful on that. So we're going to need to be nimble. But right now, based on the models, we believe it'll be safe for students to re-enter the clinical arena at the end of June. So we're going to plan to orient them probably through a virtual process and get them ready to start. One of the interesting elements in this that we need to consider is that if effective, validated serologic testing becomes available, how could we use that potentially to improve the process of getting them back into the clinic? Could we cohort students in certain areas based on their sero status? And those are the things that we're looking at and talking about that we would layer on top of this model potentially. But right now, that is our plan, is to get them back into the clinical environment, seeing patients with, I'm sure, additional safety precautions and PPE preservation strategies if needed at the end of June. And if we were to do that, and keep them on time, we probably would have to abbreviate some of their experiences, but yet still try and meet our educational objectives. And that's what the LCME, which is the accrediting body for U.S. allopathic medical schools, is really focusing on, is the educational objectives. Find strategies to meet the objectives, even if you do have to abbreviate their time in the clinic or in the hospital to keep them on pace to graduate. Because what we don't want to do is delay the graduation. As you know, Bill, and a leader in this area, is that we are a medically underserved state. And so, and 40% or, on average a year of our students will stay in state for residency. And that's an important pipeline for providers in our state. So we don't want to delay that pipeline in any fashion. So, our real focus is how do we keep these guys on pace? How do we meet the necessary educational objectives and get them out on time? In terms of our senior class, most of them had met the graduation requirements by the time we locked things down in the middle of March. Some did not, so we looked at each one individually and tried to explore if they met the educational objectives of the activities they had not completed. And are working through that process, and we'll have formal approvals in place. We believe we'll be able to graduate 100% of our graduation eligible seniors so that they will be able to start residency on time. There are some states, as you know, Bill, New York, Massachusetts, there may be others by now, have established programs for their incoming interns to start earlier. Right now, and looking at our landscape in Alabama and talking to our GME program directors, at least under the UAB umbrella, there does not seem to be any interest in doing that right now. There's a lot of elements that would go into that, including how do you pay for them. But right now, we feel like we're staffed appropriately to handle the surge in the cases that we're currently, treating in the state of Alabama. So our guys, unless they're going to New York or Massachusetts or areas like that, and are requesting an early graduation, we've gotten no requests for that right now. We're planning to graduate them on time, which for us is going to be in the middle of May.
Well, great. I think you covered the waterfront there very well. I've got a couple of questions though about the impact of this, and then also about, well, what this may look like going forward. The first is, okay, I understand the PPE issue, and about obviously we want everybody to be safe, all our healthcare workers. But I'm trying to picture myself as a junior medical student. This is the biggest thing that's hit American medicine in maybe any time in its history, certainly in anybody's lifetime right now. And I'm sort of put on the sidelines. Mm-hmm. I'm not in it. I don't get to see it. I don't get to experience it. I understand there's a lot here to balance, but what do you say to, hey, could be a very, there's hazard here, but that's true of physicians and trainees going back as far as it goes. Mm-hmm. And they don't get to experience that. Is there, how do you answer that? Is there a surrogate for that? Just in terms of forgetting about all the other issues for the moment.
That's a great point. And I will tell you this, is that if we let them back in, 100% of them would be back in today. They're chomping at the bit to engage. And we've told them it's not that you do not provide value to our healthcare delivery teams. And as you and I both know, in dealing with students, is they provide value in the delivery of patient care at UAB and other places in the state as well. So they want to be here. They want to engage. But again, we need to follow national guidance on this, from the AAMC, from the LCME, and the PPE issue is real. It's going to be more significant at different times through this, but we needed to acknowledge it. But the students absolutely are in medical school for the right reasons, and they want to be, taking care of patients today. And if we let them, they would. So ways that we have mitigated that is we have, through Dr. Caroline Harada, who runs our service learning programs at UAB for medical students, has opened up a tremendous amount of opportunity. So, most of the phone calls that are occurring to patients that have gotten drive-through testing, either at UAB or through the Christ Health mechanism, the FQHC in town, the people who have tested negative, if their phone calls that they've received have been from UAB medical students.
Right.
So they've been highly engaged and looking at any way that they can to be a part of this process, to contribute in a meaningful way through service. They're not sitting at home watching Netflix. They're actively looking for opportunities in the research arenas. There's many projects going on at UAB doing descriptive analyses, data mining, things like that. The students are front and center in that process, and are willing to do anything to be a part of it. And again, if they could be, right here in the middle of it, they absolutely would be doing it if we would let them.
Right, that makes a lot of sense. Now, let me ask you, as an infectious disease physician, I want you to think about, where's this going to be 3 months or 6 months from now? The coronavirus may not have taken a holiday entirely at that point. How will you manage medical students if there's some low-grade ongoing sort of issue, or if it does go away like influenza for the most part in the summer, but comes back in the fall and winter? Do the students have to disappear again, or do you have a plan for that? And then we're about out of time, but just
right
as a quick answer to that.
Those are things that we're absolutely thinking about, and I believe it's not going to just go away. I do think that we're going to be vulnerable to second waves. particularly as social distancing becomes more limited, if it does. So it's absolutely going to be a part of it. And that's why I think, having an effective, validated serologic test will be beneficial to us in advising students and cohorting students around certain activities or not. And that's going to be an important patient safety element for all healthcare workers moving forward. So that's going to be a big part of it. But ultimately, we have to hold out hope for a vaccine. At one point, there was 9 candidate vaccines that were in the pipeline. There's probably more than that today, that are starting phase 1 work. So that ultimately would be, the answer moving forward. But your point is a good one. Will medical school ever be the same? Will our delivery of content ever be the same? And I don't think it will. I think we're going to take advantage of this, pandemic and learn from it and really modify how we do things. I mean, telehealth in itself, what would be the important educational objectives for medical students around that? Because I think telehealth will become a more important tool for us moving forward, independent of the virus.
Right.
So it may just become a more efficient way to provide care for certain patients, and we're going to have to teach students how to do this.
Yeah.
So it is going to impact our curriculum. It is going to impact how we teach our students moving forward. And we have to learn from this. But we're going to have to, until we have a vaccine that's effective, we're going to have to continue to monitor this and think about it. But a whole-scale stoppage, again, is something that I think all of us are going to want to avoid. And so we need to prepare for those waves potentially and how we're going to address it. At UAB, we've not had that, to my knowledge, of our 780 students or so across the state, we haven't had a single one that is COVID positive. We've only had 13 residents to date, and none since April 1st that have become infected. And about half of those 13 residents out of our 1,000 residents and fellows, probably acquired it in travel, pre-March 15th or so. So I think a lot of the strategies that we're using right now have been very effective in making our healthcare workers safe. And we certainly can learn from that relative to reintroducing students into the hospitals and the clinics.
Well, Craig, thanks so much, and thank you for all you're doing clinically as well as administratively. And like you say, there are about 350 of those 3rd and 4th year students at any given time, and that alone is a big responsibility. So thank you, Craig Hoesley, and thank you for watching this video. If you found this is helpful for you and the people you work with, please like it on Facebook. Follow us on Twitter, and share these with other people so they can be out there in a timely way for people who need to see the content. And that's on the ACP website or on the MASA website, and there is a YouTube channel off the ACP Facebook page. Thanks, and see you next time. Bye-bye.